The other sort of big story of the moment now, Arizona Senator John McCain's family says that he will discontinue medical treatment after being diagnosed with brain cancer last year. They released a statement saying, quote, last summer, Senator John McCain shared with Americans the news. Our family already knew that he had been diagnosed with aggressive glioblastoma, and the prognosis was serious. In the year since, John has surpassed expectations for his survival, but the progress of disease and the inexorable advance of age rendered their verdict. With his usual strength of will, he has now chosen to discontinue medical treatment. Our family is immensely grateful for the support and kindness of all his caregivers over the years. Okay, so joining us now is CBS News medical contributor Dr. David Agus to talk about the progression of this disease. I'm sure, doctor, when you heard the diagnosis, glioblastoma, you know that it's a very difficult type of cancer to treat.
In July of last year, he was diagnosed with glioblastoma multiforme, the most aggressive form of brain cancer. And he was a hero. He was transparent with his diagnosis and how he was going to take it on. A team of doctors got together. He was treated initially and had a good response. And then uniformly, 100% of the time, this disease comes back. And it comes back around now, anywhere from 10 to 14 months afterwards. And at that point, cancer is one of the few diseases that every time you treat it, it gets stronger. And it gets stronger. And that's what happened here. Coupled with the fact he's over 70 years old, coupled with the fact that he has multiple other medical issues going on, he has chosen, based on his value system, not to pursue treatment, and it is the right thing to do for him. And his family's around him, and he's going to say goodbye like a hero, like he wants to.
Is treatment for an illness like this, is the idea to cure the person, or is it to just give them a fighting chance to live out a bit longer than they perhaps might be able to if they weren't being treated?
So the data show that standard treatment for glioblastoma, which was chemotherapy and radiation, makes you live longer, and it makes you live better. The hope in that, and you know, there's always this hope in every cancer doctor, and especially in every cancer patient, is during that time period, something new will come along. Something new that can actually make you live longer, and then something new again. That's what we all hope and pray for. But if you look at the data and the statistics on glioblastoma, they're grim. There are things on the horizon. 60 Minutes did an amazing piece on a new way of treating glioblastoma with the immune system in a viral vector, poliovirus, down at Duke University. There are other things happening now that can slow the disease, but the disease always wins. We have to do better in what I do, which is caring for cancer patients. We're not there yet.
And so how common is this?
Glioblastoma is not uncommon, but it's not common. There are, obviously many people afflicted with this disease, and, this is the same disease that Ted Kennedy had. And Ted Kennedy, treatment was allowed to keep him under control, keep his disease under control, so he can see President Obama elected to office, which was one of his dreams. And so treatments allow patients to live longer and better and hopefully go out the way they want. At the same time, I want to get better against treating this disease. We have to get better against treating this disease. And Senator McCain, took this head on. Remarkable doctors, a remarkable hero who said, listen, I want to fight as long as I can. And he did. That night in the Senate, when he came in here and voted against health care, everybody will remember that night and his defiance standing up.
Yeah.
And so what comes next? I mean, I think a lot of people are wondering what this means for the next couple of days, but generally for somebody who decides to make this or makes this decision, are we talking months? Could it be a year?
So, obviously I have no crystal ball. And with this disease, when you give up care, normally you're talking days to weeks. And so care is required because this is the brain, and when it gets a little bit bigger, inflammation can actually cause vital functions in the brain to shut down. So it normally means a shorter term. Although, again, I'm not involved in this decision with the senator.
Are they, people who are going through this, are they able to carry on conversations? Are they able to enjoy a meal? I mean, what is the life like while this disease takes a hold of you?
It's a great question. Is that certainly my job as a cancer doctor is to make people die with dignity. And how they live and how they die, both of those are just as important to me. And the goal is no nausea, no pain, able to the last minute, hopefully, to have conversations with their friends and family. Steve Jobs is emblematic of that, as he literally did business the morning he passed away.
Is that right?
And so the hope is that people don't die from cancer. They live with cancer literally into the moment where the cancer wins.
Dr. David Agus, thank you very much.